Okay, so our project is electrode-induced glial cell differentiation for responsive neurostimulation. I'm Mary.
I'm Christine.
And I'm Stephanie. So the clinical need for this is that 5% of children experience a seizure before the age of 20, and seizures can be defined as sudden surge of electrical activity in the brain. It can be with or without warning and also with or without convulsions. The first option for treatment is medications. However, 30% of epileptic patients are likely to have drug resistance, and the cost for medications, doctor's visits, and unplanned hospital visits are up to $500,000 annually. So the next option is VNS, or the vagus nerve stimulation. However, that's only about 50% accurate, and it can cost up to $10,000, not including implantation. The next option is RNS, or responsive neurostimulation, and this is the device that we will be modifying. However, there are still limitations with that, including it's a very invasive surgery, and it's only available for patients that are 18 years or older, so there's still a pressing need for better treatment of seizures to increase the quality of life for epileptic patients.
So our approach is to reduce the glial scarring that is brought about by RNS systems. And for the growth factor, we chose GDNF because first of all, it's produced in the glial cells, and then it also does not cross the blood-brain barrier, which makes it easy to locally deliver the GDNF. And also we're going to coat this on PLGA, which is a bioresorbable polymer, and we chose PLGA because it releases a natural metabolite, which makes it inherently biocompatible. We also chose GDNF, and we think that we want to release the GDNF only when there is a seizure only after a seizure in the area of the brain, and so we will also have an extension to approach where we will have a magnetic charging of the neurostimulator by using a headband, and this headband can be charged once a week, and it's also going to be charged by magnetic induction, which is less risky to the patient than electrical charging.
So for testing our device, we're going to do some biomechanical testing, which will include cyclic loading of the electrical current, and that's going to be sent at the current that the electrodes will send at the onset of a seizure. We will also be doing mechanical forces of up to 220 pounds, which is the max force of the skull, and that will be used to test stress shielding of the device to the skull. We will be doing biocompatibility tests, including measuring the inflammation around the electrodes and also determining corrosion of the electrodes to determine the degradation over time. For biofunctionality, we will be doing GDNF control studies and testing the battery life, charge time, and reliability of the rechargeable battery.
Alright, so some benefits for our product. It will limit the glial scarring that occurs at the electrodes with the RNS system. This glial scarring oftentimes causes impedances for these electrodes and eventual encapsulation of these electrodes. Also, 9% of patients experience some sort of infection or inflammation from these electrodes, so our product will most hopefully reduce this infection and inflammation. Some costs. So since the RNS system is covered by insurance, we believe that our system will also be covered by insurance, but if not, it will probably cost upwards of $20,000. We'll have to spend some of our time and resources for quality assurance and control to make sure that our product is safe and reliable for patients. This is a combination device because the RNS and the growth factor are both approved by the FDA, so this will take approximately 10 years to get FDA approval. So some competition, we have the vagus nerve stimulation, and our product is going to be more beneficial for the patient than the vagus nerve because with vagus nerve, oftentimes the patient won't have a noticeable decrease in seizures for almost 2 years, whereas we hopefully will see almost an immediate decrease in these seizures. And then for the RNS system, the electrodes do oftentimes cause this glial scarring, and with the growth factor that we will have on our electrodes, this glial scarring will not occur.